On the day Ontario smashed another record for new COVID-19 infections, more lines for a booster vaccine.
I have an appointment which is like way far away, but I just wanted to make sure that I can get something faster as things are getting worse by the hour.
Those accelerating case numbers across Canada are likely even higher than reported, as the wait to get test results, even to get a test in the first place, grows. Some provinces have maxed out their swabbing capacity. Now they're trying to conserve resources.
So I want to be very clear. Do not go to a testing center unless you have symptoms. And then we need to preserve the more accurate PCR testing for those who really need it.
Younger Manitobans, those under age 40, those without underlying medical conditions, if you have respiratory symptoms, cold-like symptoms, flu-like symptoms, you can assume you have Omicron. You can stay home and isolate. You don't necessarily need to go get tested.
Quebec is ordering millions of extra rapid tests as the worst-hit province also starts to prepare for a hospital surge. Nearly 500 of Quebec's healthcare workers have tested positive for COVID-19 in just one day. Now the province is reportedly considering letting infected staff keep working as long as they don't have symptoms, a plan being met with objection.
Things evolve quite rapidly. You might have someone that's asymptomatic and infected and within a couple of hours are symptomatic, and the next thing you know, we're infecting people who are patients and infecting our colleagues, and we have outbreaks in our hospital and we lose more healthcare staff.
Nunavut is in a lockdown with cases now in 4 regions. Anyone who arrives in the territory who isn't triple vaccinated must self-isolate. As healthcare workers across the country beg Canadians to cut down their contacts.
If we see all of these infections all at once without some spacing out due to restrictions on gatherings, then we're going to have a real problem again.
And Marina, with the holidays upon us, are we getting any official recommendations on whether Canadians should change holiday plans?
Well, on a day that Ontario broke this record for new infections, we didn't hear anything from government officials. The health minister did tweet that they are keeping an eye on the data. In Manitoba, the public health officer there urged people to cut down on the size of their holiday gatherings, but he stopped short of bringing in any new restrictions there, hinting some could be coming next week. And that's likely the next time we will know how severe this situation is getting, as many provinces will not be reporting COVID-19 infection data over the holiday weekend. Anita?
Thanks, Marina. For more insight, let's bring in epidemiologist Rewat Deonandan. He joins me from Toronto. Rewat, as we said earlier, that spike in Omicron cases still hasn't been enough to drive up hospitalizations. Should we take comfort in that, or is there reason to worry those numbers will in fact creep up?
We should take comfort in it. There's always a reason to be hopeful here. But we have data out of the UK that suggests that, there may be an intrinsic mildness to Omicron as compared to Delta, but it's not by a lot. And the hypercontagiousness of Omicron means that even that mildness probably won't protect the healthcare system. So that's why we have to curtail transmission as much as we can. A tiny fraction of a large number is still going to be a very large number.
So though we want to curtail transmission, it is still happening at a fast rate. Can you give us a reminder of some of the tools Canadians have to get us through this? Because I think for a lot of people, it's getting harder.
Yeah. The important point here is that COVID is airborne, and that means we have engineering tools as well as personal choice tools to use. Those engineering tools include HEPA filters, ventilation, keeping your windows open. They include N95 respirator masks, not just the blue surgical mask we all become used to, but a fitted respirator mask. As well, we have rapid tests. It's hard to get them these days, but rapid tests are a really useful tool to, maybe if you're going to have a gathering, making sure that people present are unlikely to be infectious. And of course, vaccination. Vaccination remains our number one tool. If you're not vaccinated, please become vaccinated. If you haven't been boosted, seek out a booster. I'll also add symptom checks. If you're symptomatic, regardless of your vaccination status, maybe don't be seeing people right now until your symptoms abate.
And at what point do you think then that we just learn to live with COVID like we do with a common cold or flu?
Yeah, that's a dangerous and interesting question. Omicron might just be the last great COVID battle in this pandemic, and it might take us into the end of the spring. Some of the modeling suggests that, at which point you might have sufficient immunity from recovery and infection combined with vaccination that the waves become unlikely from there on out. So I think sometime in 2022, we're going to see endemicity of COVID. Will it be early or late in 2022? That's yet to be seen.
Everyone's hopeful for sure. Thanks, Ray Watt.
My pleasure. Thank you.